So why choose Todd Lanman? Why choose me for your disc replacement surgery? What makes me better than anybody else? Well, experience, mostly. And I've been involved with artificial disc trials since 2001 with the first Charté trials. John Regan and I were involved in that. Involved in several of the cervical ProDisc trials, prestige trials, almost every artificial disc I've been involved with, except for a few, over the 20-some years. So I put in over 5,000 discs in my career. I put in about 14 this week. This is my wheelhouse and sort of what I do. So I know the nuances of what each disc does, how they do it, how they operate, how they will work best in your anatomy. All those things need to be taken into consideration. The younger surgeon may not have that experience or that knowledge. In fact, earlier on in the beginning, 1 or 2 discs were FDA approved and the doctors were trained and that's the only disc they put in and that's the only disc they still put in. But each disc does something differently. They're all mechanically different. And if you have the wrong implant in somebody, for example, one particular disc is not good if you have a little bit of facet joint arthritis. It'll make it worse. That happened to a very high profile figure. There are a variety of reasons to pick a more experienced arthroplasty surgeon, artificial disc replacement surgeon, than picking the younger guy. What I am excited to see, however, is at Cedars-Sinai yesterday where I operate, where we're an extremely busy spine service. We run 9 operating rooms all day doing spines. And I walked around and several of the other spine surgeons who have been doing disc replacements about 3 to 4 years are putting more in now. And we're training the spine fellows and they're very excited to see these. It's great to see the spine fellows from the East Coast because when they come out, they haven't even seen an artificial disc. And most of my patients I get are from the East Coast. They still fuse everybody there. I don't know why, but that's what they do. So, but I get so many disc replacement cases and I'm getting lots of revision cases. And so it's important to choose a spine surgeon with artificial disc replacement who has a lot of experience. There are many nuances in that surgery, where the center of rotation of the implant needs to be, depending on your anatomy. It might be different than where my center rotation needs to be, and which implant is better for your facet joints behind the spine versus other ones. There's just a mind-boggling amount of information that you learn after 22 years of doing this, or 23 years of doing this. And so it becomes important to choose an experienced arthroplasty surgeon. And so I'm one of those. Yeah, I'm a little more money, okay? But like we say, how much would you just pay me to be out of pain and not have to go back and revise your surgery? You know, some people pull up here in a Rolls-Royce Bentley and they complain about my surgical fee. And I'm like, your car is more important than your spine? It just doesn't make sense. So people need to kind of think about that. But it's important to pick a highly experienced spine arthroplasty surgeon getting an artificial disc replacement. Sometimes you'll do great, but like anything, the more experienced someone is at it, the more likely they're going to get a better outcome.